Hi, good afternoon. Welcome, everyone. We're going to give a few additional attendees just a couple more minutes to sign on to the webinar, and then we'll get started. Okay, I think we can get started. Again, welcome everyone, and thank you for joining our webinar today, which is part 3 in our stewardship series. I'm Marla Moreland, and I'm the Business Development Executive here at NOVA. And today we're going to be focusing on executing strategies and increasing employee engagement opportunities. And I think everyone will agree with me that increasing engagement can be a struggle, which can make executing actionable strategies nearly impossible. So just a few little housekeeping items before we get started. If you have any questions during the presentation, don't be shy. We love questions, so please type them into the question box in your GoToWebinar control panel, and then we'll have time at the end of the presentation to address your questions. And today's presenters are Charlene Zielinski and Peter Fry. Hello, Charlene and Peter.
Hi, Marla.
I was going to say, I hope somebody says hi to me. Charlene has more than 15 years of experience in the self-funded industry with a strong background in network analysis, reimbursement account operations, and client relationship management. Her current role now is a strategic client partner at NOVA, and she's responsible for the retention and growth of profitable membership for an assigned group of clients. So she works with those clients to develop long-term strategies that meet their current and future corporate goals. And Pete has nearly 15 years of experience as well in the industry, and he holds his master's degree in public health. Peter works together with our clients to manage. He designs, implements policies and procedures relating to their wellness programs and activities to improve employee health and well-being. And he also facilitates changes and additions to the programs that reflect the changing needs of the client's employees. So now that we've covered their very impressive backgrounds, let's get started. Our last webinar focused on the central part of NOVA's stewardship formula. So we highlighted the 4 areas of risk and opportunity and discussed how to take that planned data and transform it into innovative strategies for improving healthcare spend. So today we're going to talk more about how to analyze the impact and outcomes of the strategies and take that information to then reevaluate how to move forward and increase employee engagement. So with that, Charlene, I am going to toss it over to you.
Thank you, Marla, and welcome everyone. Marla and I work together closely when we bring on new clients. She provides the account management team with all the information that she has available. This allows our team to have a better understanding about the client and their goals prior to our first meeting.
Yes, that is so true. We do have several pre-implementation meetings, excuse me, to exchange information about the client and their needs. And we talk a lot about benchmarks of where they are now and where they'd like to go. Definitely want to discuss some of their sticking points and how we can get through to the client and their employees to get them to engage. So, you know, ultimately, we just want to ensure that NOVA is a good fit for the client and vice versa.
Absolutely. Historically, we were yes people, but as we've grown as an organization and gained experience, we become more selective in the type of accounts we bring on because it's better for our clients in the long run. Aside from the initial information that we're gathering with each client and their population during the sales process, we have developed 2 forms to assist with getting additional details. We have our client culture questionnaire and our market due diligence survey. We're going to take a deeper dive into our client culture questionnaire. Here are some sample questions that we ask our client. These questions give us a better idea of how their benefits impact recruitment and employee retention, build plan designs to meet both the employer and employees' needs, identify barriers that members have when it comes to receiving care, and understand when the client's concerns with regards to their prior carrier administrator. I'm going to turn it over to Peter, and he can discuss the market due diligence survey.
Thanks, Charlene. The client culture survey that Charlene just discussed focuses on data specific to the employer group. The purpose of the market due diligence survey is to gain insight into the health of the state, city, or county where most of the employees reside. So we're taking a look at the larger community. NOVA typically completes this type of analysis internally, so it's not something that we ask the employer group to do. In the market due diligence survey, we're targeting two types of data. We're targeting health risk and outcomes, so kind of that social determinants of health, and community resources. Some of my favorite websites to collect this data are from the County Health Rankings and Roadmap, which is a Robert Wood Johnson Foundation, and Kaiser State Health Facts, as well as local, state, and county websites. The county data can be helpful when a plan is transitioning from fully funded, as they may not have access to their claims data. In the absence of claims data, the county data can provide useful benchmarks and help us identify some chronic conditions that are prevalent in a larger community. The community resource component of the market due diligence survey is helpful to aid our nurses, provides nurses insight into our community where the members they are working with are living. In addition, we usually get a couple of local resources that nurses can refer their individuals to, or that the employer can leverage within internally. Based on the information we gain from the client culture survey and the market due diligence survey, we gain an insight into the healthcare goals and barriers of a company. So in completing these surveys, we've learned that not all companies approach their benefits in the same manner. Some groups are very cost conscious, other groups want to offer great benefits with a headache-free experience. Those are the websites that I referred to before that I like to kind of use for some of our benchmark data. So what we're going to do today is that, knowing that companies have different goals, we are going to profile two companies and walk through the recommendations we would give to each company based on their company profile. Charlene's going to walk us through or give us an overview of our two sample companies.
Thank you, Peter. Through this process, here's what we've identified about our two companies. Company A, they're located in Austin, Texas, have 200 employees, and their median age is 27. Through the client culture questionnaire, we know that they recognize employees who show initiative, provide employee autonomy, and have an average tenure of 1 to 2 years. Through the market due diligence survey, we know that they have access to the Central Texas Diabetes Coalition. As Peter kind of referenced, it's a great resource to have available for employers because it's at no cost. He's going to provide a little bit more additional information during the observation and recommendation section, but we're also able to identify their healthcare costs, their diabetic monitoring, and their PCP ratio. Company B, they're located in Chicago, Illinois. They have 1,000 employees. Their median age is 49, and they have satellite offices. Through the client culture questionnaire, we know that they view benefits as a recruitment tool and to retain talent. They have strong union ties, and their tenure is an average of 10 to 25 years. The market due diligence survey found similar results that they showed for company A. However, we found a different community research, which was the Cook County Health Hotspot. Through our clinical data, the market due diligence survey, the client culture questionnaire, and company goals, we're able to create custom recommendations for each of our clients based on their strategies. We know that one size does not fit all.
For this mock analysis, we're going to pretend that each company asked us to implement a wellness program. And we're going to also assume that similar observations were made within each population. So we have our goal and our observations. While these companies have the same goal of implementing a wellness program and similar observations, we know their approach to their healthcare benefits is different, as well as their company profiles is different. So in the following slides, we're going to look at each observation and recommend a solution for Company A and Company B. So our first observation was a high prevalence of diabetes. For Company A, we'd recommend a focused effort on raising diabetes awareness. As Charlene mentioned, through the market due diligence, we discovered that there's a Central Texas Diabetes Coalition. The purpose of the coalition is to provide diabetes education and raise diabetes awareness. The employer group could leverage this coalition to host a lunch and learn to their entire employee population. An additional offering of this coalition is to provide a series of six 90-minute classes designed for people living with type 2 diabetes. So they can target their larger employee population to give a general knowledge of the condition, and then targeted education for the people that have the condition. In addition to the lunch and learn, the employer could offer or sponsor the JDRF Diabetes Walk that takes place in Austin each year. Employees could be encouraged to participate by walking or volunteering at this event. For Company B, we would make the recommendation that the employer implement a value-based plan design. A value-based plan design uses financial incentives to promote cost-efficient healthcare resources. So as it relates specifically to diabetes, some adjustments they could make is to cover at 100% diabetes-related office visits, and they could also waive or reduce copays on Tier 1 and Tier 2 medications. Typically, you can offset the cost for those high-value services by increasing the cost share on low-value services. There's a website, it's called vbidcenter.org, and it kind of dives into high-value services and low-value services and some other recommendations when implementing the value-based plan design. Moving to our next observation, it was a low screening rate for the ages between 25 and 40. So for Company A, we suggest the employer offer an incentive for completing a preventive visit. Based on their client culture survey, we know that the average tenure isn't very long. So we might suggest using an HRA as a delivery mechanism for the incentive, as this would allow the employer to recoup any unused funds if the employee moves on to another organization. For Company B, a possible solution would be biometric screenings. Biometric screenings help raise awareness. Sometimes the results from biometric screening alone is enough to prompt an individual to set up an appointment with their PCP. Biometric screenings can serve as a foundation or a launching point for a larger wellness program. Within this larger wellness program, they could set up a preventive visit as a line item in their program. They could also, further down the road, implement an outcomes-based program, but this biometric screening would be kind of that starting point. The idea is to find out about any conditions that are existing in the population, so whether it's through annual visits, preventive screens, or biometrics, to help identify the unknown conditions. The biometric screening solution is a little bit more of an investment in your workforce. And it's also difficult to measure a true ROI on wellness programs in general, and real savings may not be experienced for a number of years. So you must take the company's goals as well as their culture into consideration. Given Company B's long employment tenure and use of benefits as a recruitment tool, that's where we came up with the recommendation of biometric screens and thought it would be a worthwhile investment. Our third observation was a high urgent care utilization in both populations. With urgent care, typically knowing that there's high utilization isn't really enough. Additional claims research is often required. Some of the questions we like to ask when we see high urgent care was the utilization driven by a few high utilizing members or scattered throughout the population? Was the urgent care the proper setting, or could it have been taken care of in a different setting? And it's also important to distinguish between high cost and high utilization. For Company A, we're going to pretend that there are CPT codes, that we did not have CPT codes for preventive visits, and we were unable to find an attributed provider. So we'll often look to see if a member has a PCP or an attributed provider on file. If we don't see any CPT codes that make that relationship, we can assume maybe that urgent care was the member's first stop. So our recommendation would be to implement some type of care navigation or network counseling to let individuals know the appropriate resource to be using. So along with the care navigation, the other recommended solution would be telehealth. This is typically it can be priced at a cheaper alternative to urgent care, and there's the flexibility of the appointment time and the member not having to miss work. We recommended a similar solution for Company B, but without the care navigation. When we looked into the claims, visits were on the weekend and diagnosis codes were much more appropriate for the urgent care setting. Telehealth is a convenient option when their primary provider is not available. Our last observation was high out-of-network utilization. So for Company A, or similar to the urgent care, when you see high out-of-network utilization, you often have to ask why. Was the utilization in the area where the member resides, or did it occur when they were traveling? Was it for a certain specialty, or were there other options? Was that specialty covered in-network? For Company A, we would recommend that they remove the out-of-network benefit completely, as we noticed that much of the out-of-network utilization was in the area of Austin, and they didn't have a lot of traveling or a lot of extenuating circumstances why they were accessing the out-of-network benefit. For Company B, we would implement a customized network solution. So as we mentioned, they have a number of satellite offices, and often when there's a satellite office, the members may need a different network or a customized network solution, as often people will be traveling, students could be away, kids could be away at school. So we would tailor the network for the remote staff. I don't know, Charlene, the network's kind of your bag. Do you have anything to add on this one?
Well, for no two employer groups are the same. So really we want to make sure that we have a custom solution that's available to each of our groups. And we really want to look at where the geographic location is, who the providers that they're currently using. So when we know for Company B that they're satellite offices, we would take all of that information and find exactly which network's going to be the best for them. We really also want to focus on the fact that for the plan, the network solution has strong discounts. When looking for a solution, we also want to make sure that members have a little risk of getting balance billed. So if we are implementing a regional primary network, we want to make sure that there's a national solution when they're traveling. And as we said, we can set up different departments to make sure that each member has a setup for them.
Thanks, Charlene.
You're welcome.
So NOVA is not a PBM, but one thing we didn't really cover is some of the cost-saving tactics that a PBM could use. So if you're working with a PBM, you would definitely want to implement some of these programs into your plan. Step therapy, specialty copay assistance, and how the PBM handles rebates, as well as mandatory mail order and mandatory generics. There can often be some great savings for a plan within those programs.
Now that we've gone through the observation and recommendations, let's review how we can implement these strategies. We recommend implementing strategies over the course of a few years so that members are not overwhelmed and the plan can see the results of these changes. If you remember, Company A focuses on recognizing employees who show initiative, provide employee autonomy, and have an average tenure of 1 to 2 years. We would work towards implementing a wellness program that would make immediate impact for the plan. Based on this information, we would recommend implementing a mandatory annual primary care visit, as well as require members to enroll in the telemedicine benefit. Your TPA or carrier should be able to provide files to track this information to take the burden off of the employer. We would also recommend participating in a community event. This just gets employees more active. It could be let's just use the example of the diabetic walk or run. For plan recommendations, implementing the telemedicine benefit, we would also want to review cost sharing for the urgent care and emergency room to help steer members towards the appropriate care and eliminate the out-of-network benefit. For Company B, they focus on their benefits as a recruitment and retention tool. They have strong union ties and the average tenure is 10 to 25 years. For this company, we would want to work towards implementing a program that would make both long and short-term impact. Implementing the wellness portal. This provides members with the tool to track their health year over year and provide resources to members to improve their health. Biometric screenings would be implemented, and that would provide a comprehensive report directly to members and an aggregate report to the plan so that they can see, they can possibly implement future changes that will help their population. We also recommend implementing an outcomes-based incentives program. Once the biometric screenings have been in place for a few years, groups can move towards this outcome-based program that incentivizes members to maintain a healthy lifestyle or improve their known conditions. The plan recommendations for Company B are to have the value-based plan, implement the telemedicine benefit, and implement the customized network solution. To assist with member engagement, your TPA or carrier should have resources available to each member. While both companies have the same tools available to them, we need to focus on the areas that will get the most return based on the population and the employer goals. For Company A, the recommended tools would be the Nova app and portal, member materials, the health coach outreach, as well as support during open enrollment. Providing education on how to log into the tools and when they become available is really important just to get in front of it. For Company B, we will leverage the same tools as Company A, but given their investment in the biometric screenings, employees would benefit from the wellness portal to track their health data and have a year-over-year comparison. So it's important to focus less on the analytic tool. Focus more on the actual data and what insights it has when pumping up to what makes sense for the plan. Account management and the health plan performance team need to work together when making recommendations for each client based on their goals as well as their actual data. A client needs to be comfortable when making changes to their plan. They may choose to implement these recommendations or file them away. This is an ever-changing process, and the data needs to be continuously reviewed. As a result, the same recommendations may come to the table during the next review. However, if the group still feels that it's not the right time, they may elect not to move forward. It's really about when the group is comfortable with making changes to their plan. Remember to share appropriate findings with the client when the data supports your recommendations. The carrier or TPA should be able to anticipate questions and or concerns that the client may have on how these changes will impact their plan and as well as their members.
Thanks so much, Charlene. That's good stuff. I think we are close to wrapping up here, but I would like to take the time to highlight our last webinar in the stewardship series, which focuses on actionable intelligence and guidance on how to manage plan performance. So we certainly hope you'll consider joining us for that. And another reminder, you can reach out to us online via our website and give me a call should you have any additional questions. But if you're interested in receiving an example of a sample clinical report, you can just send an email to the listed address. So I do want to check for questions and see if we've got anything here. It looks like we have a couple. Question number one, after a strategy is implemented, what length of time is recommended before you reassess? I like that question a lot. I think there are times where a client gets really excited about implementing a strategy, so they want to reassess a little too quickly and maybe a little bit disappointed because they haven't seen much change. But on the flip side of that, they could also wait too long to reassess and lose some opportunities along the way to kind of tweak the program or, tailor it more to that client. But Pete, I know you work a lot in this area. What do you think about this question?
I would agree. We typically do a high-level quarterly analysis for groups, as well as like an in-depth annual clinical analysis. So that quarterly one lets us keep a quick check on things and then the deeper dive on an annual basis. I think one other thing that's important is when you're reviewing to make sure that you're reviewing the right time period for when you implement it. So allowing enough run out and making sure you're only looking at claims incurred during that time period and not paid during that time period can be really helpful in making sure you're analyzing the right data.
Yeah, good point. I also just thought of another thought about, reassessing. We mentioned earlier showing those cohort year-to-year reports. I think that's so important because I know a lot of clients that I talk to, they're like, what do I care about what the national benchmark is or the national norm? I want to know what we looked like last year and what we look like now. So that's a really good point. Okay, our second question is, how much do you involve the broker in the process? I certainly believe in full disclosure and having a pre-planning meeting with the broker. And personally, I like to have the broker involved as much as possible because I just don't feel like there's anyone who knows, anyone in the transaction or the situation that knows the client better than their broker in many cases. So I like having them involved all along the way. But Charlene, I know you work with brokers on a day-to-day basis. What are your thoughts on that?
I would definitely agree with you. And it also just is, it's really about how much the broker wants to be involved. So sometimes we have everything goes through the broker. Sometimes we provide them all the reporting, and then we have several pre-strategy meetings before doing an annual review with our client. We send sometimes quarterly information directly to the broker, and then they go to the employer. Sometimes there's a little bit more hands-off, and we just do it all together and have that relationship instead of just with the broker alone. So we're kind of easy to work with, and we're happy to work with anybody that and how they want to pursue with their clients.
Okay, great. Well, I think that is it for questions. Just let me check one more time here. Okay. Well, once again, thank you all for joining us, and we certainly look forward to speaking to you again soon. Hope you join us for our next webinar. Thanks. Have a great day.